Los Angeles. I'm here to terminate unwanted skin bumps.
I am here to seek help for treatment of my acne keloides nuclei. It's affected me tremendously in my confidence level, my ability to do my job. Between the look of them being right here on the side and not being able to hide it anymore, and the pain that I have with the soreness, the discharge, the stares that I get, it's just getting out of control, so I just need the help.
We'll be looking at using radiation treatment.
Today we're just doing a follow-up on Mr. Peters. We're looking at the results 9 months after radiation. The first thing you will notice is that the inflammation or the volume, the height of the lesion is much less. You'll notice the inflammation is not as much. You can see this whole inflammation is gone. The skin is much more supple. This is all getting flatter with time. On the back here, you can see that, again, the same thing to reiterate. You can see that all this is supple, there's no more disease. We will proceed to remove this lesion here. The other thing I want to talk about is the predisposing or the previous condition of the scalp before the AKN. Mr. Peters has something called cutis verticis gyratum, which is CVG. This is not from the AKN, this is all the CVG, cutis verticis gyratum, which is normal.
Just last year I started doing radiation therapy, and so far it's been a success. For years, since I've had this as a child, it's grown, and I think with the cutis verticis gyra, it exemplified the problem, and where I cannot, wear a white shirt or sit on a couch or lay on a white pillow. Very discomforting, a lot of discharge, a lot of pain overall in the scalp. But since the radiation therapy, it's pretty much cured that, almost like 95%. All I have left is this bigger lesion right here, which Dr.Umar is so kind of helped me out today to get that removed. Since the radiation, my life has improved dramatically. Like I said, before that it was very painful, made me very insecure, very hard to go out in public. I was wearing hats, hoodies, collared shirts. Now I feel like more of a normal person where I can just walk around and be comfortable more with myself. So I'm looking forward to this surgery, and looking forward to continuing improving my health and the aesthetics, looks on this, and hopefully improve on my life. I've avoided going to the optometrist because of this being kind of like an embarrassing thing for me to go and try on glasses and stuff like that. And I didn't want people to, thinking, oh, I don't know if I want him to be wearing or testing out glasses, I don't know what this is. Is it contagious? So I always had that apprehension. But, as I'm going to be turning 40 next year and I have diabetes and stuff, I'm pretty sure that I probably should be looking into getting glasses as I get older. But I put that off because of this disorder. One time I remember as a young man, I was going out to Disneyland with my family. The condition, particularly on the side, wasn't as severe, but it was on my neck. And I can remember walking in public, and that's one of my fears is being around people.
So today the plan is to excise or debulk this lesion here. When you do surgery in an area that has already been radiated, there's always a question of whether the area will heal as well as it would have if the radiation was not done. So there's also that risk that we are also cognizant of. And then the other thing is, this is a danger zone. There are nerves that innervate this area. One of the nerves in particular, the superficial temporal branch of the facial nerve, courses from this angle here, crosses the bone, and it goes like that to supply this muscle, okay? And part of the tissue extends there. So in the case of this surgery, we have to take care to preserve that nerve, but it's a risk that we take whenever we do a surgery in this region.
Razor bumps of the face, also called in science, we call it Pseudofolliculitis Barbae. That's when you shave and then you end up with ingrown hairs. So we're doing laser hair removal.
Significant changes around this area, which was where it was mostly severe. And then along the sides it has almost smoothed out. pretty pleased with the results so far. We'll see how she heals up, but with Dr. Umar using the support sutures, we should see good results with the healing of the scar being minimal. So we'll see how that goes. The whole thing's still not finished yet. As far as the keloids and stuff, hopefully will be done, but Dr. Umar still has some things to work on. He's currently working on my razor burns. I got a few more treatments with that, and then a rhinoplasty something with my nose. So after those things are done, hopefully I'll be, set to go and, and move on with my life.
All this is gonna go. See all this fold, and this will go up a little bit, and this comes down.